This is health. This is what 15 years of work, trust, and community looks like. In remote Mayan villages in Guatemala, children are growing up stronger, healthier, and more hopeful than their parents ever dreamed possible. Guatemala Village Health has walked alongside these families for 15 years, changing what health looks like today and for the future. Let us show you what's possible. My children face some of the world's highest rates of chronic malnutrition, stunting their bodies and their brains and their futures. Through our nutritional supplement program, we've cut those rates in half. Hundreds of children now start life healthy and ready to learn. Clean water, smokeless stoves, composting toilets, our Healthy Homes program tackles a root cause of illness at once, reducing infections, preventing malnutrition, protecting lungs, saving forests, and giving families back their time. Through permaculture farming and nutrition education, diets are transforming, improving in both quality and quantity. Families are growing and eating more diverse, nutritious foods than ever before. Better food, stronger bodies, and brighter futures. Health begins before birth. We provide iron and folate before pregnancy and access to contraception so families can invest fully in every child. And when emergencies strike, like a hemorrhaging mother or a critical baby, our team is ready at our clinic every time. None of this works without trust. Our Guatemalan team partners with community leaders and the Ministry of Health to ensure every service is effective, culturally rooted, and sustainable. Last October, we provided care in our first partner villages and saw with our own eyes how much had changed. And then we traveled just over the ridge to a place still forgotten. Here's Dr. Hook with her experience of Samuk.
Hi, I am Jennifer Hook, co-founder and director of programs at Guatemala Village Health. Arriving in Samuk was like a trip back in time. After a long, barren drive, we entered a remote Maya community with a single little tienda selling only chips and Coca-Cola. Across the road at the school, children were running barefoot in the mud. A single pit toilet stood next to the water spigot, the only source of water. In the hot sun, the villagers lined up and patiently waited for us to set up our mobile clinic. As we consulted with patients, we met exhausted women with 10 and 12 children, struggling to nurse their newest babies but lacking enough milk to satisfy their hunger. We saw elders who suffered blindness and leg wounds from untreated diabetes. Here, chronic nutrition still stunts bodies and minds. Malnourished girls become mothers before their own bodies are ready. The cycle repeats generation after generation.
In Samuk, there is no clinic. When our team arrived for our first visit, a baby had been critically ill for 5 days. The mother had no transport and no way to know how serious it was. Our clinicians knew immediately. They arranged an emergency transfer to the Caimi in El Estor and stayed with the family every step of the way. Because of our relationship with Dr. Pablo at the Caimi, the baby received close monitoring in a place where a nurse spoke their language. GVH covered transport and kept the father by his child's side. Without this connection, that situation could have been fatal. This is not rare. It is the reality for every village without services. But it doesn't have to be. Your support built this capacity in our first communities. The clinics, the filters, the relationships, and the trust. Tonight, your generosity can extend it to Samuk, San Marcos, Zapotal, and other villages. Imagine the children in Samuk 15 years from now, healthy, strong, and full of possibility. That is exactly what we have already built in our first communities. Help us reach our goal tonight and make that future real for every child.